think we are. We're about to 100 people. Welcome all. Thanks for joining us. We have an exciting update coming for the Medi-Cal program, and since you ambassadors are the ones on the ground working with the Medi-Cal members to help them navigate their health coverage, we wanted to make sure that you had the firsthand information and are really in the know on what is happening, where it's happening, and when it's happening. So to get us started, just a quick welcome. Thanks for taking your time today to learn. All of this information is available on our website, and we'll walk you through where you can find it. But today we're here to talk about the Medi-Cal Managed Care Plan transitions. And this is a result of the department working with all the health plans to renegotiate new contracts that are starting January 1, 2024. And the goal here is to advance quality, access, accountability, equity, and transparency across the system. So with that, today, Michelle's here, Michelle Retke, who is the Chief of Managed Care Operations Division here at the Department of Healthcare Services, to give you an update on exactly what's happening. We're going to give you details today. We really want you to know what's happening, why, and become the experts. We've invited Stephanie, who works with Michelle, to also give you some update on resources. And then we invited Ken from our IT shop, who's helped us really work through the user experience and help make it advance the department in sharing information to members and providers so that they can understand what's going on in real time. So that's a quick overview, and I'll turn it over to Michelle. Thanks.
Thanks, Tracy. Good morning, everybody. Can you hear me okay, Tracy? Just want to make sure. Okay, perfect. Okay, so I believe that folks have the slides. I don't know, Len, were you going to show them on screen? We'll just give it 1 second. Len or Bridget, were you able to share the slides?
Yes, Len's going to share them, but I can pull them up in just one quick second.
Yes, sorry, I'm having some technical difficulties.
Oh.
But 1 second, Bridget, I'll do it. I'll pull it up 1 second.
Okay.
Got it. Okay, thank you.
While those are coming up, as Tracy mentioned, we're going to share with you some information. All of this information is out there, and we're going to talk over later on in the slide deck about where you can review this information online and how you'll utilize those resources. But today we really wanted to talk about what we call the 2024 Medi-Cal Managed Care Plan transition. There's a lot of movement and changes happening on January 1, 2024, and really this last quarter. There's a lot of activities that are happening to talk with folks like yourself, many other stakeholders and advocates, providers, community-based organizations, and many others. So we're happy to be here today to walk through a few things. If you're following along on the slides, slide 2 for the agenda, we'll go over a little bit of the MCP transition overview, talk about the transition policies, and principles that are guiding us, and then also transition over to the communications resources that are available, and go over question and answers at the end as well.
Michelle, are you seeing the slides now?
Yes, thank you, Len. Okay, next slide. And actually, you can just go to the next one. Perfect. Okay. So as Tracy mentioned, there are many things that have happened to get us to this point. And so we really are transforming Medi-Cal managed care through a variety of different ways. We actually have a brand new managed care plan contract that will be implemented on January 1st, 2024. And all of our managed care plans will operate under that same contract. And so some of the things that happened over the last few years to get us to this point are included on this slide. So in December of 2022, there was an announcement made in regards to the department contracting with the commercial plans that will be operating on January 1, 2024. And these commercial plans, as well as all of our managed care plans, went through a robust operational readiness process that they've been working through, getting prepared to be able to execute and implement all of the policies that are in the new contract. So that new commercial kind of managed care plan mix was announced in December of 2022. We also had various counties that changed their plan model type. So some of the plan model types that I'm sure you all are aware of are our COES, or what we call our County Organized Health System model, our two-plan model, our geographic managed care model, regional model, and currently there's an imperial model and a San Benito model. Some of the counties some of the counties have changed what model type will be operating. And so we received federal approval recently that I'm sure you saw an announcement about, but for 17 counties to change their managed care plan model. And this change included 12 counties going to a COES model, 3 counties going to what's called a new single plan model, and then a few counties going from a regional model to a two-plan model. And I know that's a lot to kind of take in, but one of our next slides that we'll go over is a really handy map that will help kind of map that out for you. We also, the other large change, one more back, just finishing, is the direct contract with Kaiser. You may be following that effective January 1st, 2024, we will be directly contracting for Kaiser to operate in 32 counties, which is a little bit different than today. Right now, they operate in many counties, but they operate in the majority of them as a plan delegate or a plan partner, if you will. And now they will operate in 32 counties via a direct contract with Department of Healthcare Services. We can go to the next slide. This is just kind of a quick snapshot of the counties where the majority of the transition is happening. It's approximately 1.2 million members transitioning, but I kind of want to break that down a little bit for you. That 1.2 million members accounts for members that have to move from a plan that is exiting their county, and that member is now being either put into a new plan because maybe now in that county there's only one plan that will be operating there in 2024, or in some counties there is a new commercial plan, a new choice, and so there will be a choice process for those members. So there's a variety of different activities that are happening for January 1, 2024, and these are the main counties where those kind of enrollment changes are occurring and that kind of make up those 1.2 million members. Go to our next slide. This is a great tool. It's definitely something that I use as a resource when I'm talking with folks. The map, if you're looking at your screen on your left-hand side, shows our current plan models. And then on the right-hand side is what 2024 would look like. And it's really just mapping out and a quick snapshot what plan model types are operating in each county. And so you can see the kind of grayish color is where the COES or the single plan model operate. And both of those model types include just one managed care plan operating in that county. One of the main differences between the COES and single plan model is really that the single plan model plans are required to be Knox-Keene licensed. Otherwise, all of the plans in all of the counties are under the exact same managed care plan contract that will operate in 2024. Next slide. There's a lot of words on this slide. It's really just breaking down kind of some information about the Kaiser direct contract. And as I mentioned, in 2024, Kaiser is expanding to be a prime plan, as we called it, direct contract with the Department of Healthcare Services. Eligible members may actively choose Kaiser, but there is an indicator on this slide that kind of walks through what an eligible member would be for Kaiser. So an eligible member that can enroll in Kaiser would have to have had previously enrolled in Kaiser over the past 12 months or have an existing membership or relationship with Kaiser. They also can qualify for Kaiser if they have family linkage to Kaiser. So someone in their household or family that is, and there's some rules around that, but family linkage to Kaiser, and then they would be able to enroll. Dually eligible, so if somebody is in Kaiser's Medicare Advantage plan in that county, then they would be enrolled in Kaiser. And foster care children or youth, they also can enroll in Kaiser. The slide also walks through that Medi-Cal matching policy, basically saying that if a member is in the Kaiser Medicare Advantage plan, like I mentioned, then they would be automatically assigned or transitioned to Kaiser so that they are in the matching Medi-Cal plan. From a default perspective, the plan and family linkage that I walked through is looked at to kind of look at the history of a member's enrollment to see if they can be linked to Kaiser. And when it comes to auto assignment in certain counties, there will be the use of the auto assignment incentive program up to a specific enrollment limit. And that is identified also on our website. And we'll make sure that that link is provided as one of the resources. So again, a lot of words on this slide, but I think the main takeaway is that Kaiser will be directly contracting in 32 counties and that there are some eligibility rules in order for a member to enroll into Kaiser. Next slide. Okay. And actually, if we go to the next slide, it's really slide 9, the MCP transition principles. This is just to kind of level set with all of you before we get into some of the details that Stephanie and Sean will be walking us through. But the principles that we have really been using to guide us for this transition, because we know how large it is, we really have been trying to plan for a smooth and effective transition. We definitely are wanting to minimize any service interruptions for all members, especially those in vulnerable groups. And some of the data sharing that we're doing with the managed care plans will assist in hoping to meet this guiding principle. It's one of our principles to provide outreach, education, and clear communication to folks like yourselves, our members, providers, our managed care plans, and various other stakeholders and advocates. And then also to proactively monitor the implementation of the 2024 contract and the implementation of all of these transitioning members as well into the new plan. And so as we use these principles, we're going to talk a little bit about our member enrollment and noticing, and then also our continuity of care. So I'm going to hand it over to Stephanie Condi to walk through member enrollment and noticing for this transition.
Hi, thanks, Michelle. Good morning, everyone, or close to afternoon. Stephanie Condi. I work with the Managed Care Operations Division and helping to oversee this project. So for today, I will be walking through our member enrollment process for each individual county scenarios. So first on this slide, if you look to the left-hand side, in our choice counties, which do include our GMC, our 2-plan and regional models, members enrolled in a managed care plan that will continue to operate in 2024 will remain in their managed care plan unless they opt to change managed care plans, as they can do today. Mandatory managed care members enrolled in an exiting managed care plan will need to enroll in a new MCP. Our dual eligible members in a Medi-Cal matching plan county will be automatically enrolled into a Medi-Cal managed care plan that matches their Medicare Advantage plan when applicable. And if you go into the DHCS website, there's a page dedicated to our matching plan counties if you're interested in more information on our policy for our duals and our matching plan counties. Other exiting managed care plan members will receive a 90, 60, 30-day notice and a choice packet alongside their 60-day notice, or a few days after, actually. So default assignment. If a member does not make an active choice, they will be enrolled in a managed care plan based on the following assignment hierarchy. First, using provider linkage, then plan linkage, and family linkage. If those absent of those three criteria, a member will be placed in a plan based on our auto assignment incentive program algorithm. Michelle spoke to this a little bit earlier, which does include quality and other adjustments to an annually defined ratio for auto assignment among managed care plans in each county. In the next few slides, I'll actually talk a little bit more about the noticing in the choice packet and the default dates. But then moving to the right side of the screen, in COE's expansion in single plan counties, members enrolled in a continuing managed care plan, for example, Alameda Alliance for Health and Contra Costa Health and Kaiser, will remain in their managed care plan. Members enrolled in an exiting managed care plan will be automatically enrolled into either the COE's single plan or Kaiser when relevant. As Michelle mentioned, Kaiser will receive default assignment for exiting managed care plan members in COE's and single plan counties where it participates on the basis of plan and family linkage and the Medi-Cal matching plan policy, again, where that policy applies. Next slide, please. I will go over our new enrollment freeze for exiting managed care plans. So the department stopped new enrollment in exiting managed care plans, both for active choice and default assignment, 3 months prior to January 1, 2024. Exiting managed care plans will retain their existing membership through the end of this year, so through December 31st of 2023. In our 2 plan, GMC and regional model counties, new Medi-Cal members in late 2023 will have the choice of all managed care plans operating in their county in 2024. In our COE's and single plan models, dually eligible members and new members in late 2023 will be automatically enrolled into the managed care plan for 2024. And a little bit of information, if the new member chooses or is assigned to a 2024 managed care plan that is not yet operating in the county as a prime managed care plan, they will be in the fee-for-service delivery system until the managed care plan is available in 2024. So members in late 2023 in a new prime plan in 2024 will remain in fee-for-service until the end of this year. Next slide, please. So a little bit more about our noticing. Our members will receive a 90-day notice from their exiting managed care plan, followed by a 60 and 30-day notice from Healthcare Options, Medi-Cal Healthcare Options, which is DHCS's enrollment broker. A choice packet will be sent a couple of days after the 60-day notice in our choice counties, so our GMC 2 plan and regional counties. Welcome packets will follow from the member's new managed care plan in January 2024. Our notices do include a QR code to an online notice of additional information that provides additional details on the transition and how they can request information by calling Healthcare Options or our ombudsman. Members can request this notice of additional information via print or alternative format by just calling Healthcare Options. The notices did go through extensive stakeholder feedback and also were sent to Center for Health Literacy for readability. And our notices are also posted on the DHCS transition member webpage. I will turn it over to Sean in just a minute, but I will pause real quick for some questions if there are any.
There hasn't been any questions except for the slide deck and where it can be received. So we'll let Len or Tracy chime in, but that's it.
All right.
Yeah, the slide deck will be posted on the transition web pages along with other webinars, probably in a week or so they'll be made available.
Thank you, Len. And we, after Sean presents on our continuity of care, we'll go through all of the resources on the DHCS website, including these materials and then our notices. So I will go ahead and turn it over to Sean.
Thanks, Steph. Good morning, everyone. My name is Sean Barber. I lead the Managed Care Networks and Access operation at MCQMD, and I'm here to talk about continuity of care as it relates to the 2024 Managed Care Plan transition. All right, so the 2024 COC policy outlined in the 2024 Medi-Cal Managed Care Plan Transition Policy Guide aims to minimize service interruptions for all members and ensure continuity of care. The policy is also aimed at reducing confusion for members, providers, and our managed care plan partners, and minimizing the administrative burden for all parties involved. So COC policy exists today in a couple different places. The policy that we've deployed for the managed care plan transition effective 1/1/24 largely aligns with our existing policy, which is documented in all plan letter 23-022 with some exceptions. Those exceptions are that the department has leaned forward and gone further and added additional continuity of care protections for our members related to this transition. Next slide, please. And I think actually, can you go to the next one? I think we might have just misordered a slide here. Thank you. Okay, so continuity of care policy levers. So there are multiple different types of continuity of care. So we have continuity of care for providers, meaning members can keep their provider even if the provider is not contracted, also known as out of network with the receiving managed care plan. There's continuity of care for covered services, meaning that members get to continue active courses of treatment and retain their prior authorizations from the previous managed care plan. That policy for continuity of care for services lasts for 6 months following 1/1/24. Continuity of care for providers lasts for 12 months if the request for continuity of care for provider is approved. We have continuity of care for coordination and care management information, requiring the previous managed care plan and the receiving managed care plan to work together to make sure all additional supportive information, for example, care plans, assessments, etc., are shared amongst those plans to really try and limit any disruption in that member's care. There are additional continuity of care protections. This is part of where we've gone farther compared to existing DHCS policy. All transitioning members are eligible for protections for durable medical equipment, rentals, medical supplies, etc., non-emergency and non-medical transportation, and scheduled specialist appointments. So these levers are currently deployed through the Managed Care Plan Transition Policy Guide, the Knox-Keene Act, and the All Plan Letter 23-022, in addition to the policy guides for enhanced care management and community supports. We can go back one slide. I'd like to talk a little bit about one way that we've really leaned forward to make sure that our members' care will continue. So special populations. As I mentioned, all members required to transition plans on 1/1/24 have the continuity of care protections that I outlined on the previous slide, but we've identified and categorized certain individuals as special populations, and these individuals will have enhanced protections to minimize the risk of the transition. Those special populations are generally individuals living with complex chronic conditions. You can think individuals that are receiving or authorized to get enhanced care management, community supports, residing in a skilled nursing facility or an intermediate care facility, in addition to individuals that have other complex diagnoses. So we're requiring our managed care plans to be proactive and reach out to the providers that are serving that population today to initiate either contracts or continuity of care agreements with those providers. So this is different than the member-initiated continuity of care for provider requests that the non-special population members request. We're requiring the managed care plans to do the work here and make sure that they're reaching out to those providers to make sure that special populations members are receiving the care they need post-transition. We'll be monitoring all of our continuity of care policy via a robust post-transitional monitoring approach to the transition, and we'll specifically be monitoring how many providers our managed care plans have reached out to for our special populations members. Right. And I think that brings us to the end of the continuity of care section of the discussion. I'm happy to take any specific questions you may have on continuity of care.
So there is, and we do have question and answer at the end, but I think since we're not being inundated with questions, we can pause and I can read the question out loud, Sean. For members assigned to an FQHC safety net clinic, it is our understanding that unless patients elect to change, patients are to be retained by the FQHC to ensure continuity of care within the safety net site. Please confirm applicability when FQHC does not contract with the new managed care plan, but is contracted with another managed care plan active within that county. And it's in the chat if you need to just take another look.
Thanks, Michelle. It sounds like there's a little bit going on there in that question. It might also have like a linkage or enrollment component, but I'll speak to the continuity of care policy specifically. So in the event that the members, FQHC assignment with the previous plan, if the receiving plan does not have a contract with that previous plan, then the member would be required to request continuity of care to retain that provider. And I'll note the caveat with the special populations policy, if the member is represented as a special populations member, then the managed care plan, the receiving managed care plan itself would be required to reach out to that FQHC to initiate either a contract or a COC for providers agreement. Did that answer your question?
We'll see if Alex follows up with another question or needs more clarity. We can always tackle it at the end as well. All right, Steph, we will go back to you for communication resources before we hand it over to Ken.
All right, thank you. So this is very exciting, a very exciting slide for us, which is our transition resources on the DHCS website. So I'll walk through these, and then we have Ken on the line to actually, I believe, talk or demo a little bit further. So resources on DHCS website. As Michelle mentioned earlier, she uses a map quite frequently, and I also use that map, but we use these pages as well. They're very useful to understand the transition and be very specific for the scenarios that are occurring in each county. So I would direct folks to the DHCS website just to poke around. It's a really, really great resource. So on the DHCS web pages, you have a county lookup tool, which Ken will walk us through, continuity of care FAQ, provider frequently asked questions. You also have member frequently asked questions page. As mentioned before, we have our notices listed on the DHCS website by scenario. So if you are in a foster care aid code and want to see the impact to you specific to your county, there's a notice there that you can see as a sample of what would be sent in that scenario. We also have our notice of additional information, and that's in English and in our threshold languages posted on the DHCS website. And then we also have a bunch of resources for our managed care plans and stakeholders, including news, webinars, as Lynn mentioned, and then policy resources. We have released a policy guide, mostly for our managed care plans, but also helpful for our stakeholders, just to kind of walk through some of the policy assumptions on continuity care, enrollment, and noticing. So again, a very great resource. So I'm going to actually turn it over to Ken from the Office of Communications.
Okay, thank you, Stephanie. Len, I'm going to go ahead and share my screen. So Stephanie kind of gave you an overview of all the resources there. And then go ahead and share it. All right, we're sharing. Okay, so if just to show you how to navigate quickly to the MCP page, if you go to our DHCS web homepage, we have this MCP right here. You could just click in the middle and I'll take you right to it if you need to get there quickly. So this is kind of the homepage of the MCP transition and all those resources that Stephanie mentioned. And then you can see here the way we've kind of organized it is by audience, because each audience has kind of their own unique needs when it comes to MCP. So we organize it by members, providers, MCPs, and stakeholders. So this is just the landing page, kind of the home page, just kind of gives an overview of what's happening with the transition, just at a high level. And then there's a link here to the county lookup tool, which I'll demonstrate in just a second. So again, it's just kind of an overview page, and then you can choose, depending on who you are, you can choose kind of your path from here. So we'll go into the members first. So this is a little bit more, little fancier, if you will, because we're doing some outreach that will direct members directly to this page. They don't need to see the other pages, and so it kind of has a little more of a welcoming intro here with the graphics and whatnot. So if I'm a member, I come here, I'm kind of getting, okay, what's happening with this MCP transition, and kind of get a brief overview. And then the resources are just right here. Again, like Stephanie mentioned, a lot of this is going to be driven by notices. So there's a link to the notices. Demonstrate that real quick. So here's a notices page, depending on what county you're in. So I can choose my county. So Sacramento, it jumps down. And then depending on which plan I may be in and which scenario I may be in will kind of relate to which notice I should be looking at. It's just a reference, again, for our members. And then going back to the member page, we also have the notice of additional information is linked right here. So the English version is in a web format, kind of Q&A, so they can just click through whatever questions they may have. It just jumps down. These are anchor links. They just jumps down to that topic. Then we have the other threshold languages on the side here. Go back. So this is kind of the core of the website. Again, how can we quickly find out what is happening in my county? So this is our county lookup tool. So I can type in, let's say, Alameda, and hit search. And then it has, with the drop down, it has all the information about the different plans and what's happening. So that whether they're continuing or they won't be available in 24, or it's a new plan, let's say. And so just the bullet point information under that. And then below that, we have, again, the special situations that are mentioned, American Indian, Alaska Native, or foster, or dual eligible, that kind of thing. So this doesn't apply to everybody. So we have them in these accordion drop downs. So let's say it's foster care. So here's some additional bulleted information on how it relates to MCP for that special group. Okay. And then again, as Stephanie mentioned, we have member FAQs. Of course, is a big transition. There's always questions. So those are here again as anchor links. Can I keep my doctor? It just jumps down, and then we have all that information provided here. And then, as was mentioned, continuity of care, we have that information again in a kind of Q&A format for the members. Under providers, we have just kind of, again, introduction, brief overview. Some of the highlighted information is listed here. There is an FAQ for providers. We're still working on that language. It'll be up shortly. And then the last section is for MCP and stakeholders. Again, kind of highlighting the core information here. Notices, reference to the notices there. There's a news section for pertinent news, recent news, webinars and meetings are listed here. And then again, as Stephanie mentioned, those policy resources, it's just kind of a quick link to those, the transition policy guide, the all plan letter, and then we also have the eligibility letter here. And then finally, there's just a contact depending on what audience you're in. Again, if you're a member and you need additional help and support, that's under this accordion. And then for everyone else, we have this just the transition help email listed here. Okay, so that's just kind of a brief overview. If there's any questions, we can cover those in the Q&A, but I will hand it back over to Michelle.
Thank you, Ken. All right, it looks like a few questions have come in. Okay, this one might be dual effort. So the first one, it says, and this came in right after Sean was done speaking. So this might be for you, Sean. I don't remember you saying this word, but it was, who is a special community? I'm not sure if you referenced that, so.
Thanks, Michelle. I'm going to assume that the question is who's a special population, and look at that, the slide deck. Thanks for anticipating my question, presenter. So this is in the appendix of the slide deck that y'all will receive after the meeting. And this is the list of special populations members, or this is the list of criteria for special populations member assignment. So you can see we've got authorized to receive ECM, CS, complex care management, receiving IHSS, children and youth, and CCS whole child model. So I encourage you all to take a look at this when you receive the deck to the extent that it helps you all. The other thing I'd like to note is with the special populations policy, the managed care plan is required to reach out to the providers to initiate those continuity of care agreements, but that does not preclude the member, provider, or authorized representative from reaching out to the receiving managed care plan to request continuity of care. So just keep in mind, we don't want to add confusion with this policy. If you've got a provider, if the member's got a provider that they want to keep seeing, we encourage the member, authorized rep, or provider to reach out to the receiving managed care plan and request that continuity of care, regardless of whether or not you're a special populations member or not.
Thank you, Sean. So the second part of the question, it says, how does an overall change happen to a MCP plan? I'm going to assume that the person asking the question is maybe talking about the county plan model changes that happened, where maybe a managed care plan is exiting and a new plan is coming in. So if my assumption is correct, I'll jump in. There's multiple ways that the plan in a county can change through a direct contracting process, through a procurement process. The county plan model changes led to plans changing in counties, and there was a process that counties and plans had to go through with the department to make that request, show a variety of deliverables to the department of how they would implement that new plan model type. And then there was definitely a federal approval process as well. So if that answers your question, hopefully it does, and if not, feel free to put something new into the chat. Okay. When members are moved from HealthNet to Molina in LA County, members have the choice to go back to the original health plan, ? So yes, and that's actually part of that 1.2 million members that I was speaking to earlier. Part of that are members that are in HealthNet today that will be assigned to Molina as they're a plan partner to HealthNet in LA County, and there is an assignment process. But yes, a member's choice is always first and foremost. So if a member would like to go back to HealthNet, that is an option for them, and it does indicate that in the notice that they'll be receiving on or around December 1st, which is about 30 days prior to the transition. Okay. I have a question regarding Kaiser Direct Contract. I'm just taking a quick look. So it's regarding a foster child who was adopted by their foster family, has partnership and Kaiser insurance through the parents, adopted parent's employer. They moved to a county, COES model that has partnership, and their health care is at Kaiser in a neighboring county where they used to reside. Would the child be able to choose Kaiser rather than partnership as their MCP? So there's a few pieces to that. I'm gonna there's some pieces we've been working through with the Prime plan and Kaiser as a current delegate, but becoming a Prime plan in those counties and have some processes in place. So Steph, I'll hand it over to you.
Thank you. Ari, one of the scenarios, it depends on what county you're talking about. If it's a county where partnership and Kaiser won't be operating, the member has a choice to go to Kaiser. And we have been working with the Prime plans, like partnership for example, to get a list of the members who are currently delegated to Kaiser or to Kaiser's network. And so we have been working with the Prime plans in order to get those members who have Kaiser over to Kaiser without having to call Healthcare Options. In this case, it's a little bit different since it's across a county line. So if it's a county that does have partnership and then Kaiser as a subcontract, since it is across county lines, the member may have to call Healthcare Options to get into Kaiser. And then there is a process just to get them qualified. And since they have Kaiser already, they would definitely be able to enroll into Kaiser. So in this scenario, it just depends if Kaiser is in that county, in the county where they are residing. And based on that question too, more specific help, if you do email on the DHCS website, there's a email, a transition email. If you want to email the scenario in, we can look into it a little bit more, just to be a little bit more helpful, since it is very specific. But thanks for your question. Hopefully I helped answer it.
Okay. Sean, I'm going to hand this one to you. What will happen for those members who are under some type of treatment or have surgery scheduled and are moved to a new health plan?
Thanks, Michelle. So yeah, this is protected by the continuity of care for services policy. So for 6 months following the transition on 1/1/24, receiving managed care plans are required to honor all prior authorizations and existing active courses of treatment. So that would include scheduled surgeries. The one nuance I'll note here is that, COC for provider also somewhat comes into effect because there's no guarantee that the member's existing providers are in network with the receiving managed care plan. So although the services will remain authorized, there may be a requirement for the member, authorized rep, or provider to reach out to the managed care plan and request continuity of care for that provider. It's the plan's responsibility to ensure that the services and active treatment remain uninterrupted. But there's no guarantee that a receiving managed care plan and an existing provider will be able to come to an agreement. So you may have to switch providers, even in the event that your services will remain authorized. I hope that answers the question, but happy to take any follow-ups as needed.
Thanks, Sean. Okay. Can any duals enroll in Kaiser managed care plan, or do they have to meet the linkage requirements? So one helpful tool that Steph mentioned and Ken is on our website, Can I Enroll in Kaiser Permanente, is talked about in a few different places. And so it does talk through to meet one of those requirements. And you having both Medicare and Medi-Cal as a dual eligible and are enrolled in Kaiser Senior Advantage plan or the DSNP would allow a member to be enrolled in Kaiser. Okay. If a county is a single plan, such as Alameda County and Alameda Alliance is the plan, will the PCP choice be taken into consideration when they go to an ambulatory clinic? For example, if I have Alliance PCP Kaiser, can I be sent at Highland Hospital? Sean, do you want to take that one a little bit? I mean, obviously from the plan that will be operating in Alameda County is Alameda Alliance. And as Sean walked through, there are various continuity rules. But I don't know if you have something specific for this one, Sean.
Yeah, I think there's a couple things going on here, right? So Kaiser operates in Alameda today as a subcontractor, right? So you could be technically a member of Alameda Alliance Prime Managed Care Plan, right? And a member who is with Kaiser as a subdelegate in Alameda today would likely transition to Kaiser 1/1/24. However, in the event that a member chooses to stay with Alameda Alliance rather than going to Kaiser, continuity of care policy would apply, and they would be able to request continuity of care for that PCP with Kaiser. But again, there's with continuity of care for provider, there's no guarantee that that will occur because it's contingent upon the provider, in this case Kaiser, and the existing plan that they would be in, Alameda Alliance, coming to an agreement. So the request can be made in the event of special populations member, then it would be up to Alameda Alliance to request continuity of care on the member's behalf. I hope that answers your question, but I'm happy to take any follow-ups as necessary.
Just to add to that, Sean and Michelle, Lenny, in the scenario, if you're in Kaiser's provider network, you will get a notice from Kaiser with information on the transition as well. So you will, if you're in Kaiser's network through Kaiser and Alliance, through their sub-delegate or their contract, you will get a notice too with more information.
Thanks, Steph. And it might be worth mentioning too, like if it's the member's desire to stay with Kaiser providers, I think it would likely behoove the member to shift into Kaiser as a managed care plan effective 1/1/24. I think that's the best way to ensure the member will continue to be able to receive care at Kaiser post-transition.
Thanks, guys. So if the patient is a dual eligible member or a dual member with Health Net, does the Medicare portion also go to Molina? So Steph, you want to jump in? Because I think that our kind of matching plan policy would be a part of this response.
Yeah, so thanks for the question. Your Medicare plan does not change based on these changes. So your Medicare plan always will remain unless you call your Medicare plan to make that change. So I just wanted to make that part clear. In a matching plan county, which Los Angeles is a matching plan county, your Medi-Cal plan, if there is one, will match your Medicare plan. So if you have Health Net Medicare, you will be required to have Health Net Medi-Cal. If you have Molina Medicare, you will be required to have Molina as a Medi-Cal managed care plan.
Thank you. Okay. So will a member, this is an overarching question, will a member get notices about these changes? There's a lot of changes. So yes, and one of the slides that Stephanie went over, lots of words on the slide, but does go over the various noticing options. But Steph, maybe if you want to share a little bit about maybe just to drive home like our website and how they can do the county lookup tool as Ken went over, because I do think that was really helpful because then it kind of walks through the notices as well.
Sure. So if you go to the DHCS website and you click, which we have made available on this slide, and maybe we can put in the chat box as well so folks can directly access it today. There's a membership page. And on that membership page is what we call a county lookup. All you have to do is put in your county. And then your county will pop up and will have the different type of noticing that you may receive based on your 8 code, based on if it's becoming either like a COES expansion county or a single plan, or you have a choice county, which means you have multiple plan options and you will receive a choice packet. So this is just such a great tool, but it does actually have a sample of the notice you would receive. So you can know ahead of time. The notices are in the mail today, and so members impacted already should have received a 90-day notice from their managed care plan, but then the department is sending a 60 and 30-day notices as well. They're in the mail, so you should get them very shortly if you have not already. Thanks, Ken.
Thanks, Steph. Okay, it looks as though from a question standpoint, I don't see anything else flowing in. Just taking a look. Tracy, do you want me to hand it back over to you to kind of close us out for today?
Sure, you can. We just want to thank you all, and we appreciate you taking the time. We did in the slide deck put a couple emails where if you had questions, you can definitely email the department directly and we'll help you navigate those. And also do take time to get to know the resources on the website. We've really tried to be thoughtful and provide them in a way that are easy to navigate. You know, we always welcome your feedback and appreciate your time today. Thank you.
Thank you for having us. Have a good day, everybody.